Hi there, guys. This is my presentation on pneumothorax and hemothorax. So I'm going to explain to you guys what a pneumothorax and a hemothorax is. So a pneumothorax is a collapsed lung or partially collapsed lung. It occurs when air leaks into the space between the visceral pleura and the parietal pleura, or the pleural space, causing pressure and causing the lungs to collapse. And then the hemothorax is like a pneumothorax, it's very similar, except for instead of air, it's going to be blood that enters the pleural space. Causes of hemothorax and pneumothorax include medical conditions, injuries, and lifestyle factors. Under medical conditions, they're mostly going to be respiratory related because it is dealing with the lungs. So you're going to be dealing with asthma, pneumonia, COPD, cystic fibrosis, collagen vascular disease, emphysema, endometriosis in the chest, idiopathic pulmonary fibrosis, lung cancer, Marfan syndrome, tuberculosis, acute respiratory distress syndrome, coronavirus, and lymphangioliomyomatis. I'm sure I'm not saying that right, but whatever. And then injuries as well. So like blunt force trauma, something that could puncture the lung, a gunshot wound, a stab wound, lung puncture during a medical procedure like a biopsy or nerve block. Some lifestyle factors that contribute to pneumothorax and hemothorax are inhaled drug use and smoking, also constant flying and scuba or deep sea diving. Those two are primarily because of the change in pressure and how your lungs have to adjust. And then other risk factors are family history, it can be genetic, pregnancy, and tall, thin body types. Some demographics, the risk of spontaneous pneumothorax, which is kind of you're just breathing and then suddenly there's kind of like just suddenly just have it. In heavy smokers is 102 times higher than in non-smokers. And then spontaneous pneumothorax occurs in 7 per 100,000 men and 1 per 100,000 women annually. COPD has an incident rate of 26 pneumothoraxes per 100,000 a year. And traumatic pneumothorax and hemothorax is the second most common injury in chest trauma for account for 300,000 cases a year in the United States. So in regards to the anatomy, pneumothorax and hemothorax is mainly the primary system effect is going to be the respiratory system. Pneumothorax can escalate to what they call attention pneumothorax. Attention pneumothorax occurs when there's so much pressure in the pleural space that it causes a mediastinal shift. And that mediastinal shift can cause more pressure to the other lobe that's not affected, causing an increased respiratory rate. And that mediastinal shift also causes tracheal deviation and subcutaneous emphysema, or also known as crepitus. So tracheal deviation is basically literally what you think it is. It's when your trachea is literally shifts to like a different side. It's not in the center anymore. It's actually kind of crazy. And then subcutaneous emphysema or crepitus is air between the tissues. So for a hemothorax doesn't really go to tension. That's actually really rare. If not, it doesn't do it at all. Just because the amount of blood it takes to fill that pleural space and to cause that much pressure to cause some kind of like tracheal deviation, the most likely possible thing will happen is that person will go into hypovolemic shock due to all the blood loss. Physiology and symptoms. The excessive amount of pressure in the pleural space can cause the patient to have the following symptoms: shortness of breath, chest pain, sharp pain upon inhalation, chest tightness, tachycardia, tachypnea, low blood pressure, and hypoxia or cyanosis. During a tension complication, so like I explained before, those extra symptoms would be tracheal deviation, JVD, which is jugular vein distension, and subcutaneous emphysema, crepitus. And then left untreated, it just keeps going on and on. It'll lead to respiratory arrest and then soon following cardiac arrest. So mortality rates in 10% of cases, secondary spontaneous pneumothorax is fatal. The risk is higher if you have COPD or HIV. The risk of occurrence after the first pneumothorax within 5 years is 43%. Of the patients with thoracic trauma, on average, 26.7 patients who had hemopneumothorax, which is blood and air in that potential space, they died, and 57.1% of hemothorax patients died as well. But many of these patients had other severe extrathoracic injuries that may have contributed to their deaths. In diagnosing, how would you know that if you're going to have a pneumothorax or hemothorax? Is through MRIs, CT scans, thoracic ultrasounds, and X-rays. In regards to treatment, a chest tube may be used to treat pneumo and hemothorax. The tube can be used to suction the blood in the hemothorax and relieve air pressure from the pleural space in pneumo, so the affected lung can reinflate. In both cases, surgery via thoracotomy may be needed to repair the damage. For AI, a 2022 study found that AI can be used to detect simple and tension pneumothorax in chest radiographs. The study used 1,000 chest grafts, and AI was able to detect any pneumothorax with a 94.3% accuracy rating. Early detection of pneumothorax can help determine the need for emergent clinical intervention and rapid triage to improve patient care. These are my references, and thank you guys for tuning in into my presentation.